Hello everyone, I am Dr. Bhavamik Joshi from Aspire MDS, and in this video we will discuss about the favorable and unfavorable fractures of mandible. Before that, let's see the surgical anatomy. There are two groups of muscles, elevators and depressors attached to mandible, which will cause opening or closing of it. The elevator group of muscle, they'll exert upward and forward as well as medial pull, such as the mandible will get closed. For example, we have masseter. The direction of the muscle pull is upward and forward. Now remember this is going to help us in classification of fractures. The medial pterygoid, it also causes upward, forward and medial pull. They are helping us in closing the mandible. Whereas the depressor group of muscles, they cause downward and backward pull in an intact mandible. These muscles are digastric, geniohyoid, genioglossus and mylohyoid. So when there is a fracture, there will be break in the continuity and the coordination will be lost between this group of muscles. Okay, and if the coordination is lost, when two fragments will be made, the one that is towards the condyle is known as proximal and the one with the teeth is known as distal fragment of mandible. Okay, now if both these fragments, if they stay together because of the muscle pull, they are called as favorable fracture. And if the muscle pull distracts them away from each other, they are called as unfavorable fracture of mandible. Based on the direction, they can be classified into horizontally favorable or unfavorable and vertically favorable or unfavorable fractures. The horizontal favorable fractures, we see them from the horizontal plane with help of the radiograph such as OPG or lateral oblique. So in the horizontally favorable fracture line, the fracture line pass from superior to inferior direction in a anterior manner. So here you can see this fracture line, because it is passing like this, the distal fragment will cause stopping of the proximal fragment from being displaced. Okay, so that is why it is called as favorable fracture, because the treatment will be easy because the proximal fragment has not been displaced. This is called as horizontally favorable fracture, as we can see in this OPG. In horizontally unfavorable fracture, the fracture line will pass from superior to inferior direction in posterior manner. Because of this, whenever there is muscle pull, it will easily cause displacement of the fragments. So as you can see, proximal fragment being pulled superiorly. Here also in OPG you can see superior displacement of the proximal fragment. Same thing we can see in this 3D CT view where the proximal fragment has been pulled superiorly. In the vertically favorable or unfavorable fracture, we can see it in the vertical plane such as axial section of the CT view or submental vertex view. Here you can see in vertically favorable fracture, the fracture line will pass from anterior to posterior manner from buccal to lingual side. In this case also, the proximal fragment will be prevented from displacement by the distal fragment. Same thing can be seen in this CT view where the proximal fragment is not displaced. This is 3D CT, which also shows the fracture line such a way that the proximal fragment has stayed on its place. In the vertically unfavorable fracture, what we can see is that the fracture line will pass in the anterior manner from buccal to lingual. Because of this, the proximal fragment can be easily pulled inside. Okay, same thing we can see in this 3D CT view where the proximal fragment is pulled inside. This is known as vertically unfavorable fracture. Thanks for watching the video. Don't forget to subscribe to our channel for more updates.